Welcome, welcome. As I see it, politics and more. Today we are going to discuss prisons and them being the new mental health hospitals. This is a topic that I also recently did as a project in college. Just as a background, I am a psychology student. I am going for pretty soon, I'm going to be adding my master's program in school, and I will be also going for my PhD. I am going to react as a psychology student to a bunch of different topics as far as politics and some social justice issues. And today I decided to talk about prisons and the mental health care system since this lies very near and dear to my heart. I have family that works in the prison system. I also have had impact with people in prisons. So I have both points of view, and I can objectively speak from both points of view. So I wanted to cover this today. All I ask is that no matter what your point of view is, you remain respectful. It is okay to have a different point of view as long as we remember not to attack one another and try to learn from one another. All right, I am going to start off by talking a little bit about some of the studies that are shown. We're going to also watch investigators. They went into the prison system or the jail system and investigated this. So we're going to react also to that. So, all right. With the information that has been uncovered and the QR Press article I had uncovered by Sage in 2015. Some of this was from Michigan and Wisconsin. So more than 1 in 5 Michigan prisoners in 2009 had severe mental disabilities, according to the University of Michigan study. But only 65% of those had received 65% of these no treatment previous of 12 months. So what's crazy is, echoing a nationwide trend that began in the 1960s, Michigan closed 3/4 of its 16 psychiatric hospitals between 1987 and 2003. That is a lot. And then hello, Shelly, how are you? Glad to see you. So what my concern is a lot of times peace officers or correctional officers, when they go into a prison system, a lot of times there are prisons that hire straight out of high school or as young. You don't even need much training. And my issue with this is there is a lot of mentally ill that are going into prisons and jails. And they are not trauma-informed trained. They, most of the time, cannot handle mentally ill patients or prisoners, and then a lot of times they get thrown in the hole. And most of the time they actually end up working long hours. They're understaffed, and I feel for also the staff of the prisons. I do. I'm not saying I only feel for the prisoners. I don't. I feel for the staff also. I feel like this whole system in itself, we have an issue. Most correctional officers are mandated double overtime, if not double shifts. So they get really mentally tired. Most of those people see some really horrific things. They are not, most of the time, they are not made to seek out mental health care themselves, which I believe they should. I believe when you work in a mental or in a prison, you should be seeing a therapist no matter what. So that is just one of my opinions on this, because I feel like when you are working with a bunch of mentally ill patients and prisoners, you probably should also be seeking mental health care yourself. So to move along with this, states have lost $4 billion in treatment funds in the last few years, according to the study, forcing them to close and shrink mental health clinics and hospitals. That is a staggering amount. Yes, most prisoners have some degree of mental illness. Exactly, you're right. I agree with you. So here's the problem. My issue is just sticking people in a prison doesn't do anything, especially because the recidivism rate is so high. This does nothing for actually treating people. We should be focused on rehabilitation. So in Madison, Wisconsin area, Dane County Sheriff Dave Mahoney says he put suicidal or dangerous mentally ill inmates in solitary confinement because he has no mental health facilities. It's inhumane and human rights violation, Mahoney says. But he has been able to persuade the county to provide more than 100 million needed to update his jail. So where I have issues is we also have a shortage on mental health care clinicians. And of course this is near and dear to my heart. I'm going into this profession myself. So if we're going to truly reform people and we're going to focus on getting people better to try to actually get them healthier, to be better citizens, wouldn't it be also better to train not only the people who work in these prisons, but maybe also figure out a way to get more clinicians inside the prisons and jails themselves? I mean, this is inconstitutional. About 15% of men and 31% of women in local jails suffer from serious mental illness, such as schizophrenia, bipolar disorder, and major depression. Rates 4 to 6 times that are the general population. Most are in jail for misdemeanors, often petty crimes such as trespassing, disorderly conduct, and drug use, resulting from a combination of homelessness and mental illness. This is for jail. So if we ask ourselves, a lot of these jails are also full, it's not just prisons, jails are also full of people who have mental health issues. And a lot of them are in there for, if you look at the homeless population, a lot of them have mental health issues, or they probably wouldn't be homeless. So we have to ask ourselves, how are we actually treating them by sending them to jail or to prison? So I'm going to play a little bit of this clip, and then we can go on and I can talk a little bit more about some of the information we can discuss. But I would like to react to this clip given. I thank everyone that is here. Thank you all for my supporters. If you have made it this far, like and share and subscribe. And let's get into it. The problem with getting clinicians jails that are mentally ill are violent. So yes, I agree with that. But the way I see this too is they are violent, but we also have to care for their mental sanity too. So in saying that, we can't, the answer isn't just to throw them in the hole or just to medicate them. We need to be trauma-informed care. And so the prisons that here in America that are on more of the private sector, they actually do have more funding for psychiatric care. Now there's a debate on whether it's ethical to have privately funded hospital or privately funded prisons, because there is ethics in that, and I agree. But I also feel like whether they're violent or not, we still need to get the mental health care in there so we can try to take down the violence. Because I also care about the safety of the people working in the prisons, obviously. I mean, a little bit of background, my first husband, his father worked in a prison for 25 years, and I lived with him helped him out, and he retired out of that prison. And I heard horrific stories. He used to come home and tell me what it was really like working at the prison. And most people think it's prisoners against COs. And believe it or not, there are COs that actually do care about trying to get the prisoners better. Now, not all the time. There are some bad eggs, which I will agree to that. Okay. That's interesting. Yeah, I have some background in both. I have family and friends. I actually have 2 friends that work in one in a women's prison, and my ex-father-in-law in a prison in California. And I currently actually have a friend of mine that is going to right now a camp, or basically training to work in the prison, kind of like the police department. And I actually even have friends who were in prison. So I have both sides and views on this. All right, so let's take a look at this video right here, and we can react to some of this. Obviously, I will be stopping part of this. We can talk and continue.
I'm Susanna Frame with the King 5 investigators. 2 years ago, we unearthed a massive problem in the state of Washington. Criminally ill defendants sitting in jail, waiting for treatment for months and months at a time. It was unconstitutional, and we exposed the many ways that it was hurting not only the people in jail, but putting public safety at risk as well. Now, it's years, and since that time, we've seen a massive turnaround. The state is now getting people out of jail, not in 5 months, but 5 days. But right now, let's take you back to the beginning, when we began our series, Mentally Ill, Waiting in Jail.
Sir, let me explain my expectations in the courtroom.
Over the last several months,
Your Honor, the suffering here is egregious.
our cameras were rolling
I have anxiety.
as a record number of defendants deemed incompetent to stand trial filed into court.
He has now been incarcerated 4 months.
People with mental illnesses so severe they don't understand the charges against them.
It looks to me like maybe you're hearing voices today. Am I right about that? Yeah.
We are asking the court to dismiss this case.
We saw defense attorneys routinely asking judges to throw out the charges
Defense is asking the court respectfully to dismiss the charges.
because their clients are sick and languishing in jail without mental health treatment for lengths of time never seen before in the state of Washington. Alexander J. of Seattle is one of those defendants.
The amount of time that Mr. J is being required to wait is barbaric.
In April, a judge found he was incompetent to stand trial and ordered he be sent to Western State Hospital in Steilacoom to try to get stabilized. The treatments.
Now, I find that interesting because in some states we have, some of the states here in America, we actually have trouble getting inmates and people in jail to mental health hospitals, as a lot of them are closing, which I find a shame. I actually have a problem with this because we need mental health hospitals open. Yes, I agree with you. Mentally ill, there's also a big issue with mentally ill people are also homeless because they're often released and get reoffend, and that's because there is not a lot of aftercare. There's not a lot of programs that help these people once they get out of prison, especially dealing with addiction or dealing with these mental. A lot of times they only give them a certain amount of their medications and then they cut them loose, and then they expect them to try to make it out there with the lack of help. And the problem with that is you can't expect someone who's mentally ill, when they run out of their medications, to stabilize themselves. So they're obviously going to recommit the crimes. So we need a little bit better system. So when they exit these prisons and jails, we need a little bit better system. So that way we can help them transition into maybe more stable mental health care and more stable social workers and things like that. And you know, what's a shame is here in America, I don't know about other countries, but here in America, we actually have a shortage on mental health care clinicians, which is a shame. It's sad. And there's tons of reasons for this. One, the schooling is hard, is expensive. The schooling is very expensive, and it's a deterrent. And then internships can be very hard to get into. So there's that shortage. And then you actually have to sometimes look at the balance of pay versus the cost of school. So sometimes that's very imbalanced. And then you have to look at the generations that, you know, they may not want to go into this profession. And a lot of people, especially the younger generations, aren't looking to go into university. So it's a ton of issues that are along with this. And it's a triple and a ripple effect. So obviously this issue is near and dear to my heart because this is something I really hope to be able to even fix, even as a clinical social worker or clinical psychologist. Because even though I may not be working in a prison full time, because I will have probably an office, I hope to be able to change this. There was an incredibly sad case of a woman that asked to be put back into a prison. They told her she was free to go. She went and attacked young. Yeah, and that's the sad thing is people offend just so they can have a place to stay because what else do they do? I mean, that's also an issue here is the homelessness issue. People sometimes go offend because they don't know how to make it otherwise. I mean, especially when you live in really cold climates like where I live right now. It reached 1 degree last night. It's 16 degrees Fahrenheit right now. It's cold. It's very cold. So you will run into those issues too. Exactly. Like some people would actually feel more comfortable in the prison system and in the jail system. And that in itself begs the question if they're mentally stable or not anyway, and they're not. I mean, if you were to actually go talk to most homeless people, which I did when I lived in Skid Row in LA, I lived near Skid Row. This is actually when I lived in Bakersfield. I used to travel to Skid Row all the time. I used to go talk to these people, and most of these people have been through really hard things, and they suffer a lot of mental illnesses. So they wouldn't be homeless if they didn't have the mental illnesses issues. And a lot of times that's also why they're addicted because they have co-occurring issues, addictions. So, all right, let's continue on this video.
It's called competency restoration. The court ruled Jay needed to be out of jail and in the hospital within 7 days. But he's been waiting behind bars for more than 7 months.
It's unbelievable. You want it to be done.
Kim Hayes is one of Jay's alleged victims. A light rail security camera captured this random attack in March as she was going to work as a trauma nurse at Harborview. Her clavicle and ribs were broken, and she thought she could have been killed.
Can you characterize or put into words what this whole experience has done to you?
It has changed my life.
Kim says the state's delays are unacceptable for everyone.
I want to move on.
I completely agree with you. When you mix addiction on top of illnesses, it gets so bad. But then I also have a lot of compassion for people when they have addiction issues because most of the time someone never ever wakes up and says, I want to be addicted to something. I choose one day just to wake up and take heroin. Most of the time they are taking away some sort of pain, whether it's physical or mental. And I do feel for that.
On with my life, but I would move on quicker if we, for him, that resolution of getting him into an appropriate bed, an appropriate place.
You think you could heal faster?
Yeah, oh, absolutely.
In a 2015 order, federal judge Marsha Peckman ruled the state is violating the constitutional rights of some of its most vulnerable citizens, that jails are not hospitals, and the mentally ill are being warehoused while they wait for services.
See, now, this is also where a lot of, they shut down a lot of mental health facilities because a lot of them were ran down. It costed too much money to keep them up. And a lot of them were ran cruelly, which I understand. But this is why we just change how they're ran. So instead of shutting them down, my thought process is, and most other people, keep them open, put the mentally ill inside of the mental hospitals, separate the jails and the prisons, so that way the corrections officers have less to do. So, okay, there we go. Okay, so I'm going to give a little bit of more information as we continue this. So, a fraction of the cost of incarcerating mentally ill inmate, he continued, we can empower new community health centers and establish comprehensive discharge planning and humane, fiscally prudent. Situation has become especially acute in nationals, local, and county jails. In one weekend, 48% of some 1,000 inmates at Dane County Jail were taking at least one psychotropic medication for mental illness, according to snapshot census by the jail. That is a crazy amount of psychotropic medication, and a lot of times it numbs these people. It doesn't actually treat the problem. It's not trauma-informed care. So what I find is when you stick these people in a cell, especially solitary or something like that, and you just shove medication at them, you're not really treating the problem at hand. You're just throwing medication at them. So mentally ill inmates are more likely than other prisoners to end up in solitary confinement for breaking rules. They can remain isolated for up to 23 hours a day, a form of sensory deprivation that is stressful even for those without mental health issues. That is crazy to me. Yes, I agree. Mental health hospitals are not good places to be. They're historically inhumane, which nowadays we can change that. Historically they were very inhumane places to be. Nowadays, though, I feel like we need to reopen, psychiatric hospitals, put better and more trauma-informed care, make it so that way we're not putting these people in solitary confinement and creating more psychiatric issues to begin with. So, yes, I do agree with you, though. They were ran completely inhumane. So when someone is in solitary confinement, you begin to turn on yourself. And James Burns, 27, who spent almost 2 years of 5-year prison sentence in an armed robbery solitary confinement prison in Colorado, starting at age 15 as a minor. He said he would punch the walls until his knuckles bled. Hurting himself felt better than feeling nothing at all. Let that sink in. I mean, here's kind of where, yes, I feel like we need to put people away for committing crimes. That is absolutely true. They need to pay for what they did. But we also need to worry about the mental health aspect too. And especially given his young age. This information, just to be fully transparent, I did a paper in school, and a lot of this information was from my notes off of Sage. It was a peer-reviewed article, and I found this information to be very relevant and extremely disheartening and sad. But yes, now that's something too, is nearly every lawyer tries to plead insanity. The client's behalf judges are overwhelmed goes to jail and clients get admitted. Now that's something too, is the judges have no idea how to handle this, because there is no real great way to handle all this, especially coming from a judge's point of view. I mean, if you look at a judge's job, they are handling multiple cases a day with a high flood of them, and they don't see it also as an easy fix, because there isn't an easy fix to this. And I know it, and most people know that.
Peckman ordered DSHS to provide inpatient treatment within 7 days of a judge ruling the help is needed. But that hasn't happened. Despite the judge's order and millions of extra dollars spent on resources, we found the state's wait times have gotten worse, not better. State records show in 2015, the average wait time for a bed at Western was less than a month. In 2022, that wait has shot up to 4 months and longer.
Would you ever have imagined that in 2022 we'd be in this place?
Absolutely not.
ACLU's legal director, LaRon Baker, was one of the attorneys on the case that led to the 7-day timeline.
I didn't think there was a universe in which a state agency would just really renege on their obligations. It's a real human tragedy.
A year after the federal court ruling, Judge Peckman railed against the state for not doing better, writing DSHS needed to stop the procrastination and false promises. She ruled the state in contempt and leveled fines for not meeting deadlines. From 2016 to 2018, that cost DSHS $88 million. After that, a settlement agreement put the fines on hold, but they're still accumulating. Records we've compiled show if it all has to be paid, the total bill would now be more than $300 million.
Wow, that is staggering. I mean, just imagine the price of that. So here's also something interesting people do not know. When you are checked into a jail or a prison, there is not any one mental health care test. There is actually more like about 8 or 9, and they're not universal. So the problem is when you're checking people into a jail or a prison, it's really hard to get a standard mental health care evaluation because there is a handful of them and they are not standardized. That's also a problem. So when you have people coming into the systems and you're trying to test for certain mental illnesses, especially when it comes to ones like schizophrenia or depression or anxiety, or ones that can turn violent, you need a standardized way to do this. You need a standardized way to test for mental illnesses when they come in. It's something that I feel needs to get better. Our system needs to get better at this because this is inhumane. Even just what they were saying, people wait such a long time to even see anyone. And then also it takes an astronomical amount of money. Oh, gosh.
I put together this database.
Doctors Brian Wablinger and Thomas Kinlan are the state's top officials overseeing Western State Hospital.
That's the total. What do you think of that?
Unbelievable.
Would you say that the state is in a crisis?
A competency crisis for sure.
This has got to be difficult.
Oh, it's crushing. It's disheartening.
The doctors say this year, the state was hit with a perfect storm, including the effects of COVID. After several shutdowns at hospital admissions, a backlog of cases are now coming through. Also, staffing is at historic lows. At Western State, about a quarter of the jobs are sitting unfilled.
I'm being subjected to solitary confinement.
And more than anything, they say there's a whopping increase in need.
We knew ahead of time that services.
So if you caught that, the person said he was also put in solitary confinement. So I believe there can be a point in time where that can be used humanely, but it shouldn't be used as often as it is. And even my father-in-law, ex-father-in-law who worked in a prison, said it was used way too much. The problem is you should only be using it when an offender is being violent at that moment in time, and it shouldn't be used for long term. It should be only used for keeping the general population safe in that moment and the staff. The problem is sometimes when they don't know what to do with someone with mentally ill, that is mentally ill, they throw them into solitary confinement, and that can actually exacerbate the problems even more.
Would be increasing over time. We knew that. What happened recently, we don't understand that. I don't think anyone expected that to happen.
DSHS is working to build new bed space. This project at Western State will add dozens of new spots next year. And they're building in Thurston.
Yes, I agree with you. COVID has definitely worsened mental illness. People that are forced to isolate. Yeah, I agree with you there.
Clark counties, trying to decrease wait times for patients and decrease the likelihood of getting dragged back to court to pay the piled up fines.
We have to be fiscally mindful, and having to pay $300 million would be, that's the taxpayers' dollars. So of course it's concerning.
I am finding the department in contempt.
So it also takes taxpayers' dollars when there's also a ton of homeless and these people reoffending and recommitting crimes. That also takes taxpayers' dollars. So the argument is where should the taxpayers' dollars be spent? Should it be spent in making more facilities and opening them? Should it be spent in putting more mental health care in the prison system themselves? Should it be spent in after the prison system, or all the above? And that's kind of something that is a big debate right now, because it all takes taxpayers' dollars. I mean, it's very expensive.
Judges are clearly fed up, saying the state's efforts aren't enough for defendants, taxpayers, and victims alike.
The delay imposed by the government is unconscionable, and it is inconsistent with the behavior of a civilized society. It is absolutely outrageous.
They've got to pay the price for not providing this, especially.
So I completely agree with you. The government isn't always friendly with spending money on social health. This is actually a big issue here. Yes, I agree with you. Yes, I believe in long-term solitary confinement will definitely turn a sane person crazy. Yes, and it's been proven it does. That is not even people can't even really argue this anymore. That actually has been proven. You can't expect someone to be in long-term solitary confinement and expect them to be mentally healthy and then ask them to be out of the system, which they do this all the time. They put them in solitary confinement and then bam, you're out of the system. And then there's not a lot of aftercare or after programs to help them out with mental health care, with their medications, with addiction specialists, with social workers. It's a problem. And it should be money spent for that. So that way we have less recidivism. It is an issue.
Especially, human care to people who need it.
So glad to
It's
see
mental
you,
health
Jamie
care.
Carpenter.
The longer this process goes on, it does take away your belief in the system, and it affects so many people.
This is Josh Stoller, who has a form of schizophrenia in what's called the cage in the Chelan County Jail in Wenatchee. 6 years ago, he was locked up in the cage or in here, this solitary confinement cell no bigger than a parking stall, not for days or weeks, but for a solid year, 23 hours a day.
Think about that for a minute. A solid year for 23 hours a day. I mean, think about what happened during COVID when people just spent time at their homes and only went to and from work. But to throw someone with schizophrenia in a cell this long and probably only got thrown psychotropic medications without the mental health care, it probably exacerbated the problem so much worse, and in turn costed taxpayers so much more money. So the question there lies. We need to get better trauma-informed care inside the prisons. We probably should put actual mental health care facilities in and maybe look at after care after these prisons, because we can't just attack one problem and expect it all to get better. We really can't.
It's hard to think about because here you are in this confined box.
Josh was in psychosis with voices shouting frightening messages.
This is the end of your life. We'll let you know when we're going to kill you. The stuff and nightmares.
That sounds like the ultimate description of human suffering.
Yeah.
Okay, so I want to actually let this, I'm going to let you guys know this. So Massachusetts became the third state to prohibit solitary with serious mental illness. Other states, including Montana, New Jersey, and New Mexico, are considering similar laws for psychology vulnerable populations, such as mentally ill or juvenile inmates. New York became the largest state to limit solitary confinement for young people, declaring it off limits for those under 18. I commend that. New York City officials went even further, recently banning solitary confinement inmates 21 years and under at Rikers Island Jail, effective year, I guess, in 15. That is amazing. That I like that there are looking at that. Surprised there is no cap time allowed. I am too. There should be a limit to how much you put someone in solitary confinement. Absolutely. You shouldn't be able to throw someone in solitary confinement and just keep them there. I don't care who they are. There should not be in solitary confinement and just stayed there. And that's the thing. That's the problem when even Chantal tries to talk about the United States. Even Americans ourselves, sometimes we have trouble because every single state has our own laws and regulations and what they do. And sometimes it can be very confusing. Now, I like the fact that each state has their own right to do so, but it also can make it confusing for our citizens to, as in America as a whole, to fully understand our own laws. So here's what's interesting. Here's an idea people have been kicking around. Oh, that's interesting. That's cool, Shelley. So that's the idea behind specialized mental health courts, which offer mandated treatment in lieu of conventional sentence behind bars. So they're actually thinking about making mental health courts. So that way, when you have mental health issues, there's specialized courts. Now, there is goods and bads to this, because the problem with this is there is so much mental health illnesses mixed in with different problems, like different crimes. The problem is how do you separate all that? We have social health care, but still struggle with the same issues of mental health. Okay. I see. Well, I think it seems to be an issue no matter what country you go into with social health care and mental health. It seems to be an issue almost in any country, I think. So that's kind of why I picked this topic, because no matter where people are from, this could be relatable and it could be something that we could speak about. So the number of mentally ill inmates in Cook County's jail has doubled in the last 8 years, according to when this article was filed. So the psychologist in charge of mental health services at the jail cited recent closures of mental health facilities, which include Mayor M's decision in 2012 to close 6 Chicago's mental health clinics. There's got to be a correlation to that. I mean, when you can't close a bunch of mental health clinics and then expect, we're cleaning this all up. She says, we have not only seen an increase in the number of mentally ill inmates coming to our custody, but we have also seen them coming in a sicker state. And that is something that I actually worry about. Socialized healthcare does not fix this problem. Clearly, other fixes need to be found. I agree. This is kind of why I wanted to bring this topic up, because I wanted to create this discussion. Because, so even look at the career I'm headed into. Let's look at this for a second. Even in clinical psychology, this question is going to be asked. A lot of my patients are not coming in because they're mentally healthy. I obviously can act as a therapist when you're a psychologist in the clinical setting, but most of my clients are going to have some mental illness. And probably a fair amount probably are going to have backgrounds to them. And so the question remains is, how do we fix this problem? Because there has to be some sort of fix to this. I see people all the time struggle with, let's even look at Chantal for a second here. She almost turned down her mental health care card, her OHIP card, or whatever that is. She is acting pretty harmful in my eyes. And I can't figure out why her family hasn't stepped in. Now, in America, it would have been hard for someone to step in, and I imagine Canada's the same way. But even these issues here at the jails, it's full of people like her. So this is a huge topic no matter where we live. So here's something interesting. For a prison to calculate its mentally ill population, it must have enough psychiatric staff to identify them, something that many prisons lack. A number of systems are under pressure to at least accurately count for the first time, the mental health care clinician says. Yeah, I agree. I think she has been self-destructive and her family has tried. That's a whole nother ballpark. And that's another ballpark. So, okay. Here's what's interesting. Experts cite the variety of causes for rising number of mentally ill inmates. Two prominent ones are harsher mandatory sentencing in the nation's so-called war on drugs. And there is a correlation to this on the war on drugs that we have. The war on drugs I've kind of disagreed with because you cannot treat drugs from inside of a prison. I disagree with this. I do not think by arresting someone, throwing them in a prison where basically they can get more drugs and learn how to cook more and have no actual treatment afterward, it's not going to treat that. So the war on drugs kind of exacerbated the problem in my eyes. That's just my personal opinion, but the war on drugs to me kind of exacerbated this issue. So in addition, the so-called broken window strategy, in which police in New York and other large cities arrest people for quality of life crimes as a strategy for preventing more serious crimes, tend to sweep up more mentally ill people. The homeless are especially vulnerable because they are peeing in the street, panhandling, and sleeping in the subway. So since that issue was brought up, the broken windows theory has been proven to be completely wrong. The broken window theory, if people are not aware, is when you have a rundown city and a city that looks a little cleaner, the broken windows theory is looking at the crime statistics based off of a rundown area versus one that looks not as rundown. I actually lived in two separate areas where this has proven to be completely blown out of the water because I lived in an area where it should be a lot nicer. The taxes were nicer, the area was nicer, but they have more violent crime. The area I'm currently living in now is ran down, less money to it, and less violent crime and less serious crimes to it. I believe because the community policing is a big issue and helps with this. But anyways, on with this. The mentally ill also swell in local jail populations by coming back more often than other offenders. A group of 400 frequent flyers returning to New York City's jails more than 18 times over the past 5 years. 67% had mental health need and 99% had a substance abuse disorder. Let that sink in. 99% had a substance abuse disorder. That's staggering. That is astronomical. So anyways, let's get on and react to this video. I do apologize. I get very passionate on this topic, and this is something that I probably can go on and make a whole series about, but we probably should react to this.
2015, police found writings about threats to kill and a list of people in Josh's apartment. He was charged with attempted murder, charges
I agree with you, Jamie Carpenter.
he says he didn't understand.
Obviously, I did something wrong, or else I wouldn't be in there, but I didn't understand.
During those months in solitary confinement, Josh deteriorated. A jail counselor wrote, he hears voices all day. Very mean people are telling him his parents are dead. He'll die in prison, and he's seeing spiders and cockroaches in his cell.
Did you even want to be living?
No.
I don't know how to quantify that type of.
So yes, that is a huge nightmare because there's actually so many drugs in our prison systems. It's astronomically crazy. You're almost sending people to actually learn how to do more drugs and gain more drugs. And the problem with that is it is so hard to treat addiction when you send people to the prison system. So to me, it doesn't work with the war on crime, sending people to the prison system. It's almost like you're asking for more problems and more money to be spent. But that's just me on my soapbox, in my opinion.
Horrific experience.
In court, we heard details of the suffering.
He is essentially in a cage 23 hours a day, and the impact on his mental health is not lost on this court.
Ms. Johnson desperately needs medical attention, and each day that she spends compounds that harm.
I'm being subjected to solitary confinement in this jail without treatment.
I absolutely believe you and understand that you are suffering up in solitary. I absolutely believe that.
Is jail one of the worst places
for someone with a serious mental illness.
It's not just one of the worst, it is the worst place for a person to be who has a serious mental illness.
Lisa Daly is director of the Treatment Advocacy Center in Washington, D.C. Decades of research shows jail is extremely detrimental to people who are sick with mental illness. A study by the UN called it a form of torture, and the longer the wait in jail, the harder it becomes to get better.
It can really cause irreversible brain damage. Basically, the longer that a person spends in untreated psychosis, the harder it is for them to return to the same level.
They can also gain more things like PTSD, have more problems with anxiety. They can create more distrust with law enforcement and mental health clinicians. It can create a lot of issues.
Level of functioning once they're actually receiving treatment again.
So it's a lot of resources, a lot of energy invested in trying to turn this number around. And unfortunately, we've not been successful in doing that.
DSHS says the biggest challenge is the increase in need. In the last 6 years, the number of people sitting in jails like here at King County needing help at a state psychiatric hospital has nearly doubled, nearly twice as many people in the last 6 years.
He got so much worse in jail.
Jerry Clark's son, Calvin, of Vancouver, Washington, landed in both the King and Clark County jails while sick with bipolar disorder.
It added terror to horror.
Jerry says after a month behind bars, they didn't recognize their son.
The system had plenty of time to figure out how to help him appropriately and instead traumatized him and his illness got worse. No one wants to believe that somebody that you love that deeply could ever experience what we went through. It is unbelievable what happened to my son. It's unbelievable.
Before the onset of his mental illness, Calvin was a skilled surfer, scholar, and state champion debater. He got a college scholarship for debate. But Calvin never finished college. 9 months after getting out of jail at the age of 23, he died by suicide.
Do you think your son could be alive today if he wouldn't have been incarcerated while he was so mentally ill?
Yeah. I believe that because of his incarcerations, he felt like he had been pushed to the bottom of society and discarded.
Josh Stoller's come a long way since his time in jail. He's a new dad and engaged to be married. He's also advocated for change in Olympia. That's Josh standing right by the governor at a 2019 signing of a bill aimed at decreasing wait times in jail. He'd hoped conditions had changed.
I agree. This is so sad. And the reality is, this is just one case that we heard of. There is a ton of people that the problem is once all this happens, they do unfortunately come home and do this because they feel that there is no other choice. I mean, they commit suicide inside the prison because they feel there is no other choice, and they feel no one's listening, and they're not getting the help they need. So it is very sad, and my heart goes out to all those families that have to deal with this.
They have. Timelines for getting help have gotten worse, not better.
I'm pissed. Very, very angry about that. If you let people languish in the conditions of county jails for that long, I would consider that a crime against humanity.
A bystander caught this video of 54-year-old Beatrice Shariga bashing out restaurant windows in the U District in September, one of dozens of alleged crimes in the area that have landed him in the King County Jail over the years. On several occasions, judges have found Shariga seriously mentally ill, incompetent to stand trial, and ordered he get treatment at Western State Hospital. But in 3 cases in the last 2 years, Shariga didn't get a bed at Western State. Instead, he waited behind bars for help that never came, and then was let back out on the street.
It's extremely disturbing. I think it just creates so much fear.
Maureen Ewing is executive director of the University Heights Center, a nonprofit dedicated to enriching the neighborhood. But crime sprees by Shariga have terrorized their staff and patrons.
I think it makes us feel helpless and like we're on our own. and that we're not getting the support that we need. And clearly, this person is not getting the support that they've needed for a decade.
This case is one of the reasons why King County filed a motion saying at the King County Jail, they're overloaded with mentally ill inmates. King County said it should be.
And if you think about this, it actually overloads not only the staff, but it actually puts other people in general population in danger. So what's interesting about this is when you're throwing a ton of people mentally ill inside of a prison or jail like this, especially jails and prisons, and you don't give them treatment, especially within a certain amount of time, their condition's going to get so much worse. They're going to probably reoffend inside of the jail or prison, occurring more charges. They're lengthening the sentence and then having less chances of getting help. So it's just basically a reoccurring problem.
Compensated for its losses, and that the entire point of the county's motion is to get defendants out of the jail and into a hospital for the services that are needed. The county's attorney said they hoped fines would spur the state to act more quickly,
so that the county is no longer forced to care for them and house them in our jail, where, quite frankly, they do not at this point belong.
And we certainly are not just standing idly by. We're working as hard as we can to get people in and fill beds.
DSHS officials say they will oppose the county's motion, that their hands are tied. The need at Western State Hospital has increased dramatically, and like the rest of the country, they're facing a staffing crisis.
We're adding capacity as fast as we can, but adding beds, building beds, unfortunately, takes time to do.
Well, an idea and thought I had, and even my professors kind of agreed with this. So as students, I'm actually seeing there's trouble with internships, especially in the psychology field. Okay. So when you're having trouble with internships as a student, here's a problem. What if we took the prisons and partnered with the prison systems and created internships for mental health care? It would do two things. One, it would create more positions for mental health care, because by the time you're ready for internship, you're going to be working under someone licensed. You're already schooled in a lot of the things you've learned at this point. When you're ready for internship, you have actually learned some of the stuff you need to be working around clients. Second, you are under someone's license. Third, if you can work with the prison systems, create more internship programs, it creates more clinicians available to help treat people. So it will take down some of the problem. It's not going to take down all of it, and it's not the solid answer. But it is a step to part of the answer. Now, here's something interesting. Caleb Broder was a sociable 16-year-old living in New York when he was falsely accused of stealing a backpack and sent to Rikers Island, a huge city jail. Broder would spend 3 years at Rikers awaiting trial, 2 years in solitary confinement, typically for repeat scuffles with other inmates. After Broder refused numerous offers to plead guilty to a lesser charge, saying he wanted to prove his innocence at trial, prosecutors finally dismissed the case, saying that the man who had accused Broder of stealing the backpack had gone back to Mexico and disappeared. 6 months after Broder returned home, he made 2 suicide attempts by attempting to... I'm not going to go into how he did it. He had frequent flashbacks of being a solitary called Rikers. Like many inmates who have endured solitary, he had no longer felt comfortable around other people, describing himself as become paranoid, quiet, and distant. Now think about that. He was proven innocent. This was at 16 years old. He was falsely accused. That is just one crimes. Now, as much as Girl World likes to attack PDFs, and I agree, those people are horrible. But there are a lot of people who are also falsely accused, and they even get falsely prosecuted, especially when it comes to marriages that go awry and divorces and accusations are made. So then innocent people all the time do get sent to prison. My issue is when people get thrown into solitary confinement and they don't get treatment, and especially in jails and they're awaiting their sentencing, jail, you're supposed to be presumed innocent until proven guilty. The problem with that is when you're thrown in jail and then you're thrown into solitary confinement with no treatment, well, you're also creating more issues than you're helping.
Shariga was set to be released back to the streets this week, most likely headed back to the U District. Instead, the King County Prosecutor's Office refiled the most recent charges against him. He's back in jail, waiting again for help from the state of Washington.
We failed him. This isn't the first time that he's been in this situation, and he is unwell and he needs medical attention, and that is the crux of the problem.
It's a grief like we haven't experienced before. And that's what I felt in the whole community. It was, no, this can't be.
The rural mountain town of New Meadows, Idaho, population 517, saw its first act of random violence anyone here can remember. A Vancouver, Washington man, John Cody Hart, allegedly shot and killed Rory and Sarah Meehan. It happened in the lobby of the historic Heartland Inn that they owned and operated.
So when I received the call Saturday, I was numb.
The town immediately gathered to mourn these pillars of the community, people they'd known for years.
They were all about people coming together for a common purpose.
Julie Good is the mayor of New Meadows.
How is it that he is free to come into our small, quiet, beautiful community and wreak havoc, not just with the family's life, but with our lives?
When the murders happened, John Cody Hart wasn't supposed to be here on the streets of rural Idaho. He was supposed to be at Western State Hospital in Pierce County, getting treatment ordered by a Washington state judge. Before Hart made it to Idaho, he was behind bars in Washington, one of about 850 defendants in the state waiting for court-ordered mental health treatment.
John Cody Hart present. If you are, state your date of birth.
September 2nd, 1994, Your Honor.
In Hart's case, he was in the Clark County Jail in Vancouver, charged with assault. Unprovoked, he allegedly attacked an acquaintance. Court records show he strangled the man and tried to rip his eyes out. Deemed incompetent to stand trial, Hart waited 4 months behind bars for a bed at
So yes, they're trying to clean house by moving him, by moving stuff from one corner room to another. It's all done under, it's not my problem. And that's exactly the problem. That's true. That's exactly right.
Western State until a judge got fed up.
I simply can't continue to hold him on the expectation that maybe someday they'll come pick him up.
The Department of Social and Health Services, DSHS, kept putting off Hart's admission date to the hospital. Judge Robert Lewis ruled his constitutional rights were being violated and released him in July to wait for a bed at Western State in the community.
I do this with some reluctance as the charges against Mr. Hart are very serious. His motion to release is granted.
Thank you very much, Your Honor. Good day.
3 months later, Rory and Sarah Meehan were dead.
It's insulting a little the reality that this didn't have to happen. It's going to be difficult no matter what. But the way that it happened and the reason that it happened, it just adds a little bit more of a punch to the pain that we're already feeling.
I mean, that's horrible to hear. That's the first I'm hearing about that.
Is that something that weighs heavily on you? Basically, I'm talking about public safety.
Of course. I mean, myself, the entire department, that is a huge concern as well. Again, want to try to get to these orders as quickly as possible.
Judges are ordering a record number of defendants get help at Western State Hospital.
So we're working as hard as we can. If we can't create extra beds or we can't create staff out of thin air, what can we do to make things work better?
This is a public safety crisis.
Rebecca Vasquez focuses on these cases for the King County Prosecutor's Office. She says the state's problem is this: poor planning and chronic underfunding, creating the worst chaos she's seen.
Our whole community is impacted by not taking care of people with serious behavioral health needs.
Records obtained by King 5 show that in King County, because of the long wait times, judges have dismissed charges including burglary, felony harassment, indecent exposure, hate crimes, and assault with a deadly weapon.
How would you characterize what you're seeing now?
Immense crisis. And the system is years past its breaking point.
And I agree. So the problem is we're letting go some crimes that we shouldn't be. Some of the violent criminals that are going back on the street, reoffending, escalating. And then the problem is the mental health care system is so broken that the people with the most mental health care issues are paying for some of they're paying for it. And a lot of times they don't make it out.
DSHS officials say the ultimate goal is to prevent people with mental illness from ever entering the criminal justice system in the first place, and they're working hard to figure that out.
Do you feel like there's hope to turn this around?
I would not be doing this job if I didn't think there was hope. We are
Agreed.
Thinking innovatively. What can we do differently?
Rory and Sarah were my friends.
Back in rural Idaho, a grief-stricken community has a message for leadership in the state of Washington.
Whatever they can do to make it so this doesn't happen again to another small community, whatever needs to happen, they need to find a way.
1, 2, 3, there we go.
Governor Jay Inslee, along with the head of DSHS, led a ribbon-cutting ceremony for what's called the Civil Center for Behavioral Health at Maple Lane. It's a $20 million state-of-the-art building that will treat 16 people at a time. People who've been found incompetent to stand trial, but ordered by a judge to stay in state care until they can be safely released. A top goal is getting people out of Western State Hospital and into beds here, making room for mentally ill inmates sitting in jails in record numbers. The opening of this 24/7 facility comes at a time that the state admits it's in a crisis. Not enough beds for mentally ill inmates who are stuck in jails across the state.
So that's the other issue is, so even in my area where I used to live, the hospital itself, so think about this, the hospital, the emergency room where you go for treatment and where you can go check yourself in for mental health care, one of the hospitals, Advocate Aurora, and I'm going to call them out, is closing their mental health care. They closed their mental facility. And what I disagree with is, where then do those people go? You're asking them to go to jails. So my issue is when hospitals even are starting to close their mental health care, then the police have to be the people to pick those up, put them in jail, and be the people to do this. And then taxpayers are also paying for this. So the money would be well better spent to make more mental health facilities to handle these people. Yes, it's going to cost money, but we're already spending an astronomical amount of money anyway.
I could not be more excited about what this represents, which is one of our first steps in the transformation of how we provide mental health to our families and the communities.
This is an emergency. This is an extreme emergency.
Kim Mozoff is the lead attorney for Disability Rights Washington, DRW, which took DSHS to federal court over the issue of leaving people with serious mental illness in jail. It's called the True Blood Class Action Case. But since that time, wait times have gotten worse for the class members. In the last year, some are waiting 8, 9, and 10 months for a hospital bed.
When I visit class members in jails around the state, they are living in conditions that I think, frankly, would shock most people. We are keeping people in conditions that are essentially torture. And right now, the state's keeping them in those conditions for months with no end in sight.
That prompted DRW to file this motion, asking a federal judge to impose heavier fines against DSHS for missing deadlines. DSHS has already paid $98 million in sanctions connected to the case. If the judge rules in favor of DRW, another $250 million could be due, bringing the total to nearly $350 million. DSHS says they're building new beds as fast as they can, and they have plans to move some patients out of Western State Hospital and into the community, making more room for those in jail. But in DRW's legal filing, they say the state should have seen this critical moment coming.
I think the state's poor planning and poor management of this patient population got us here. The crisis was foreseeable and it was preventable. So I think they need to follow through on that plan as quickly as they can.
So yes, I fully agree with you. The governments tend to be short-sighted. They want to outlay the money, and that's the problem. Is a lot of people see that a lot of them have, oh well, we're spending too much money in this and too much money in that. Well, we're already spending a lot of money, so the money should be going to where we can give the best health care and the best mental health care possible. Mental health care, I think, is one of the roots how you can actually help some of these crimes, anyways.
We'll leave it at the $500 per day at this time.
$28,500, $75,500.
And sanctions will continue until date of admission.
In Grace Harbor County, the courts are heaping sanctions against DSHS for leaving mentally ill inmates in their jail for months on end, which is against the law.
The problem started to get worse and worse. And so that's when we sort of decided to take action. Western State, DSHS, is supposed to be paying the bill, but instead, by them violating the statute, we're paying the bill.
So yes, the problem is there is so much money being spent, but we may as well just go ahead and open the mental health facilities, put more, and also, I think part of it is doing more trauma-informed training, trauma-informed care training when it comes to things like this for the COs. And so what I'm going to do is I'm going to remove this because they're mostly going to be going into the funding, which I believe is very important, but that's already been talked about at this point. So what I actually feel where I want to go with this too is I feel like what needs to also happen is we need to get more trauma-informed care into training the COs. We need to train these COs how to deal with mentally ill patients, because half the time when you notice, most of the time here in America, the COs when they're hired, they have no prior experience. And then especially they throw brand new COs in max level or the most violent areas. It should be the other way around. It should be the most experienced working and the most seasoned working in the more violent areas of the prisons, and getting the newcomers better trained, better integrated into the system. And I feel like the COs themselves need to have mandatory counseling, so that way they don't take out their own hardships on the inmates, because that actually also happens. My ex-father-in-law admitted he saw this all the time when he was working in the prison, even from COs that he respected and liked. It happened all the time. So I feel like we need to get better trauma-informed care. We need to get instead of just allowing someone to be able to apply to work in a prison with no prior experience, I feel like there should be a little bit more education or a little bit more training involved, especially when it comes to mental health care or what mental illnesses are, like schizophrenia, depression, anxiety, PTSD, CPTSD, things like that. So that way when they enter this system, they're not thrown off by it, and then they don't throw people into solitary confinement, because that's another issue. When you throw these people into solitary confinement, you're asking for more issues. I also feel like throwing people in prison for drug-related offenses instead of getting them into rehabilitation centers is also asking for more problems and creating more mental illness. Most of the time, people in addiction issues probably should just go to addiction centers that also treat mental illness, because usually when there is addiction, there's also mixed mental illness involved, typically speaking. So the issue also is part of that too. That's also part of the problem. It can't be one, we can't look at one problem and not the other and then expect to fix it all. We have to look at both ends of the stick here and look at how to fix this. So some of it is with the war on drugs issue, when people want to throw that out, war on drugs, and you're throwing people in prisons and jails for it, well, that's asking for more issues. It's like asking a dinosaur to grow there. instead of just putting more money into addiction centers and treatment centers and aftercare. Most people don't realize when you get out of prison or jail, there's not a lot of aftercare at all. There's almost none. Usually you have about a month's supply of your meds, if not 2 months, and that's not long. And then you're expected to just find everything on your own. And then after that, it's actually really hard to, because there's no resources in the community sometimes. So it's almost a circle that goes round and round. So, but yeah, I wanted to open up this topic because I felt like this was something that should be spoken about, and people should, we should speak about. It doesn't matter what country or where we live. This is a problem, and this is something that I think should be made aware. So, yeah, they wind up back on the street, and that's the problem. Is when they go back on the street, they reoffend and reoccur, and then end up back in the prison. And then what do we do? It's more money spent, and it doesn't fix anything. So part of and I've always felt like trying to treat the addiction instead of throwing people in jail for addiction. And I've always disagreed with that. I've always disagreed with throwing someone in jail over drug-related offenses. Instead, they should be mandatory going to treatment centers. Now, someone obviously isn't going to get the help unless they want the help. But at the same time, throwing them in jail over drug-related or over addiction isn't doing anything either. It's literally exacerbating the problem and creating mental health issues, and they get back out on the street with no help. It's an ever-winding problem. So, but that's just kind of my take on it. So, yeah, I kind of get heated on these topics too. So, I highly apologize. I can kind of continue with stuff like this. So, that's something that I can kind of go on my soapbox for, I guess. So, but yeah, this is a problem, and I guess it's a problem in not just America. It could be a problem everywhere. So, now some countries, I know the way the prison systems work is a lot different. And I was actually going to look into and do research on this and maybe do a special on that and compare. But I don't agree with our prison system or how we treat people in it. So I do feel like people need to be held accountable for the crimes, but I don't think we're handling things right either. So, but I probably should get going because I do have to let my dog out. It is going on almost an hour and a half, and it is really cold. It is 16 degrees Fahrenheit out here. It was about 1 degree Fahrenheit last night, and it is super cold here. So I got to bundle up and try to convince my dog to go outside because she hates the snow. So this is going to be a battle because my dog is not going to want to go outside to go do her business. So I have got to figure that one out. All right, everyone. I thank you so much for coming to my stream. I appreciate every single one of you. If you made it this far, I like the snow too, except for when I have to shovel it. So I thank every single one of you for being here. If you have made it this far, if you could like, share, and let other people know. If you are here watching the replay, comment below on what your take is on the issues we have discussed, and let me know what your opinions are and what your take on the video is we reacted to. So thank you, everyone. Thank you so much. I will see you next time.